Welcome everyone to the fifth and final webinar in the 2021 Virtual Chordoma Community Conference series. I am Shannon Lozinsky, Director of Patient Services at the Chordoma Foundation, and I will be moderating today's webinar. The previous webinars in our virtual conference series this year have focused on pain management, cancer-related fatigue, and mobility. And we also hosted an Ask the Experts Q&A panel, which is a foundational component of all of our in-person Chordoma community conferences. So we were glad to be able to host that one virtually. If you missed any of those, you can find recordings of them in the webinar library on our website, chordoma.org. We've really enjoyed hosting the virtual series this year in place of an in-person event, and we really want to thank all of you who have tuned into the webinars throughout the year. Today, we'll be talking about mental and emotional health challenges commonly experienced by people who've been affected by chordoma, which includes not only chordoma patients, but their loved ones as well. The topics of our previous webinars have focused on physical challenges, which are of course experienced directly by patients and survivors. And today's topic is somewhat unique in that regard because if you love someone who has chordoma, you might also experience feelings such as anxiety, depression, grief, or fear as part of your own journey. So we'll talk about these emotions, learn about ways to cope with them, and discuss how to support and care for yourself. And to guide us in this discussion, we have two excellent speakers with us, Jennifer Bires and Megan Whetstone, who I am pleased to say also facilitate the Chordoma Foundation's monthly support groups that we launched earlier this year. We have two groups that meet virtually, one for patients and survivors facilitated by Jennifer, and one for caregivers and co-survivors facilitated by Megan. And we'll talk more about those in a bit. Before we get started with the presentations, I wanted to say that one thing I know about all of you in the Chordoma community is that you are excellent at supporting each other. So while we're together today, I want to encourage you not only to submit any questions that might come up for you during the presentations, but also to share your thoughts if you'd like. What has helped you deal with the emotional side of your chordoma journey? What advice or encouragement do you have for others? What have you learned along the way? Anything that you might like to share, and I'm happy to, if you share that in the Q&A, I'm happy to read it out to the rest of the group. So with that, I'd like to welcome and introduce our speakers. Jennifer Bires is an oncology social worker with the Inova Schar Cancer Institute, where she is the Executive Director of Life with Cancer and Patient Experience. She works to ensure that patients, survivors, and their family members have access to psychosocial care at no cost to them to help them cope with cancer, its treatments, and survivorship in the best possible way. And Megan Whetstone is also an oncology social worker, and has worked with a number of chordoma patients and caregivers in the past. She practices at the Kelsey-Seybold Cancer Center in Houston, where she provides psychosocial support, counseling, and connection to resources to cancer patients and their families. We are so happy to have you both with us. And with that, I will turn it over to you.
Thank you. Let me share my screen real quick. Wonderful. So on behalf of Jennifer and myself, thank you all so much for tuning in and joining us today as we talk a little bit about coping with anxiety, depression, and grief. So to start off, I really want to kind of normalize talking about these things. They're things that aren't always talked about, but I do want to emphasize the sentiment that if you are experiencing any of these symptoms, you're not alone. The Chordoma Foundation recently did a study where they asked patients, survivors, and co-survivors several questions, one of which was about emotional challenges they may be experiencing or may have experienced. The top 3 reported emotional challenges by patients and survivors were fear of recurrence, anxiety or fearfulness, and depression or sadness. Now let's break that down a little further. Of all of the respondents, 279 of them were patients who had a skull-based chordoma. Of those 279 patients or survivors, 53% reported anxiety or fearfulness, 51% reported fear of recurrence, and 45% reported depression or sadness. There were also 149 patients that responded who have a mobile spine chordoma. 56% of those respondents reported a fear of recurrence, 44% reported anxiety or fearfulness, and 34% reported depression or sadness. Lastly, there were 199 patients diagnosed with a sacral chordoma. Of those 199 patients, 52% reported fear of recurrence, 47% reported anxiety or fearfulness, and 41% had reported depression or sadness. I really wanted to share those points of data with you because over half of the respondents that we had reported some type of emotional challenge that they have or are experiencing. And the same, I apologize. And the same thing goes for caregivers or co-survivors as well. So spouses, partners, family members, and friends. The top three for them were anxiety or fearfulness, depression or sadness, and feelings of loss or grief. To be more specific, of these co-survivors that responded, 79% expressed feelings of anxiety or fearfulness, 63% expressed feelings of depression or sadness, and 50% expressed feelings of grief and loss. So again, it's very common. And if you are, or if you have experienced any of these symptoms or any of these challenges, you're not alone in that.
So we know when folks are diagnosed with cancer, and you all are the experts in this, that there can be some key stress periods. And it's important to know that, just one, to normalize it, but two, to realize that you may have a heightened sense of anxiety or depression when these periods are happening. So diagnosis tends to be a really hard time because there's a lot of unknowns. The beginning of treatment or the termination of treatment, as well as a continuation on from there. And so paying attention to when you're in one of these heightened periods of uncertainty can be important in understanding how it may be impacting your emotional well-being. And that's for caregivers and patients, although it can be stressful for people for different reasons. On the next slide, what we're going to look at is just how a diagnosis impacts really all of our domains of being. And so a cancer diagnosis can be so difficult because it doesn't just impact one part of our lives. It's not just a physical impact, but it also impacts our behaviors. It impacts how we're able to think about things, and as well as the psychological impact. And again, there's this idea oftentimes that it's happening just to a patient, but really it's an entire family unit. So all of those co-survivors or caregivers are also experiencing this at the same time. And so for a unit that's used to giving each other support, as they're each going through it and experience at the same time, but maybe in different ways, it can be difficult. And so just keeping in mind that that the diagnosis will impact all of these different levels and differently at different times can be really important to making sure you're paying attention to what's happening with your emotional well-being. So depression affects 15 to 25% of people with cancer, and that is a higher rate than the general population. And I say that not to scare people, but really to normalize the experience that we do expect that there is going to be some sadness, some depression with a diagnosis. And it does impact men and women fairly equally. And so I think in society, we don't always give different genders the same opportunity to talk about mental health, but realizing that this can impact everyone in a similar way. And again, it's just not the patients that are impacted by this, but also our caregivers too. And so really thinking about everyone who's involved in the experience and how the diagnosis and treatment can impact them is important. So what do we want to look for when we think about depression? Because sometimes when we talk about depression, it's easy to say, well, that's from the treatment, or I'm feeling that way because of the medicines I'm taking. But there is, this idea of really paying attention to hopelessness or a deep sadness that lasts for a long time. And again, I want to normalize that idea of a roller coaster. We really do anticipate patients and caregivers to have ups and downs, but what we don't want is for them to get stuck in that down space. And so really paying attention to, are you having some bad days and some good days, or do the days feel mostly bad? That's a good thing to pay attention to. Loss of interest or pleasure in activities that were once enjoyed is important, and you need to differentiate. Can you just not do what you could do before, or are you really not interested in doing it? Weight loss, sleep changes, tiredness. I always suggest that people talk to people who love them and know them well, because sometimes when we get stuck inside of ourselves, it's hard to really see what's going on. And so asking those people who care most about you can be helpful. Trouble focusing. Thoughts of suicide or death are always really important to pay attention to and talk to someone about, and then mood swings. So just some idea of things that may or may not be around if you're experiencing depression. So why does this happen to some people and not to others? There's a lot of different ways to think about this. I think the most important part is that it's never someone's fault, and it's not a choice to become depressed or not depressed. There's a lot of things that go into this, like genes, your brain chemistry, stress, health, and hormones, and how you manage those. Seasons can be really important. I think for a lot of us, we're entering into winter season, and having access to sunshine or the outdoors can have a big impact. Life events like a diagnosis, family and social environment, that's become so very important during times of COVID and people really being isolated, and just how you react to life situations. And so all of these are really important pieces of why a person may become depressed. And a lot of these are outside of our control. And so really just noting this idea that it's not someone's fault. Experiencing depression isn't something that's shameful. It just oftentimes can be a part of living in this messy world that we live in. And so when we think about treatment, because there's always something we can do for depression, we don't want to just sit and live in it or be alone with it. Of course, there's medications. There is the ability to talk to people either in a group setting or one-on-one with a therapist. And we also know that exercise and nutrition are really key parts to managing depression. And something that I should have on this list that isn't is sleep. When we're not getting enough sleep, that can be really make it more difficult to view the world. And so this idea of taking care of ourselves in a holistic way is an important piece of managing depression, or even, maybe not a diagnosable depression, but those symptoms of sadness.
So some symptoms of anxiety could be feelings of nervousness, being restless or tense, maybe having this sense of impending danger or doom, an increased heart rate, difficulty sleeping, feeling weak, shaking or trembling. All of those can be symptoms of anxiety. In cancer care, one term that has recently appeared is what we call scanxiety. So if you haven't heard of scanxiety before, this is a term used to describe the feelings of anxiety or nervousness, fear for a patient or a caregiver prior to some type of imaging appointment like an MRI. Scanxiety is very common in cancer patients and their family members. Imaging like MRIs are often how patients were initially diagnosed, Or it's also how the medical team kind of monitors the tumor for recurrence. So these appointments can often be triggering, or they can lead to feelings of anxiety regarding what's going to happen during that MRI, if recurrence is going to be found, or if tumor progression is going to be found, and what the future is going to look like. Quality of life changes can also lead to increased feelings of anxiety and fearfulness. As I'm sure you all are familiar, a chordoma diagnosis comes with several changes and challenges. It can impact all levels of physical function. There can be increased pain or fatigue, and there can be several other symptoms that come along with the treatment of a chordoma diagnosis. There can also be a lot of unknowns and changes to our sense of normal. So with a chordoma diagnosis, a lot of things can change. A new sense of normal needs to be established or has to be established. And all of these changes and all of these unknowns surrounding a chordoma diagnosis and the treatment can lead to those feelings of anxiety and those feelings of fearfulness. Another impact to kind of this mental health experience is the loss and grief that you might experience. So coping with these changes in quality of life, or just changes that are going on in life, can create a sense of this loss and grief. With these changes comes a loss or change in kind of what was normal. What did life look like prior to diagnosis? Coping with this loss while also establishing a new sense of normal throughout the diagnosis and throughout the treatment can be challenging. And there can also be several changes to how a person identifies, or maybe how the roles that they played in their life. So prior to diagnosis, some of the identities that you might have had, or some of the roles you might have experienced, were that of a husband or a wife or a father or a mother, a coworker, a boss, something to that effect. And now we also add in that patient role. And it can be difficult to kind of adjust to that new role and what that means in your identity and what that means within your role. So if you, prior to diagnosis, were a caregiver yourself, and you were kind of the one that made sure that everybody had what they needed and everything was taken care of, and now all of a sudden you're put in this patient role, it can be a difficult adjustment, being the one that needs to be taken care of versus you doing the caregiving previously. So all of those different things can really come into play when we're talking about the sense of loss and grief and these mental health challenges that are very common. With a chordoma diagnosis, there can also be changes in sexuality and intimacy, especially depending on where the chordoma is located. And this is also something that can be difficult to navigate, and it's something that isn't always talked about.
So when we think about loss and grief, I think the other side of that coin is resilience. So resilience is the process and outcome of successfully adapting to difficult or challenging life experiences, especially through mental, emotional, and behavioral flexibility and adjustment to external and internal demands. And I think one of the key words in this definition is flexibility, but what's missing is this idea of growth. And so anytime we have a traumatic life event, it really is important to think about what are the things we can learn from that, or how can we grow from that. And I don't think that that means ignoring difficult emotions or pretending like everything's okay when it's not okay. But it's this idea of how can we be creative and flexible to shift to shift with the things that are shifting. And so as our bodies are shifting or as our treatments are changing, what kind of flexibility and creativity can we bring into the experience that can make us feel more resilient? So on the next slide, we have this idea of a glass half empty or half full. And we all have a certain way that we look at the world, like a lens that we look through the world at. And one's not better than the other, but it's important to know what type of person are we? Like, how do we typically confront situations in life? Because it'll give us some ideas of how we may confront challenges and where some of the spaces we need to pay more attention to. People do a lot of research on this, and we don't know exactly why some people are half full or half empty. So it's not something that you necessarily did, but it is something that can be really good to know about yourself. Because if you are someone who has a half empty glass, you may need to work on resiliency or work on seeing the positives more. So what are some of the factors in aiding recovery from stress? Some of these ideas of actively facing fears and trying to solve problems, this idea of regular physical exercise, which we've talked a little bit about, optimism or following a moral compass. Relationships are really important. So friendships, social support, the Chordoma Foundation is a perfect example of something that creates this social relationship that can be so important for managing the stress of a diagnosis. And then again, this idea of flexibility. So not thinking black and white, and we'll talk about this in a few slides, but really trying to be flexible can be important. So what are characteristics of resilient people? Because sometimes knowing characteristics can help you start to strengthen those muscles in yourself if they're not muscles that you use a lot. So this idea of being calm or innovative, I said creative earlier, but innovative can be important. And I know Megan's going to lead us through a meditation later, but how we can bring more calmness into our lives. Decisive action. So definitely looking at the pros and cons, but making a decision. Earlier, when I talked about the roller coaster, sometimes those transition periods can be so difficult because there's a lot of ambiguity and our brains don't like ambiguity. And so taking decisive action doesn't mean not weighing the pros and cons, but really, once you make a decision, making it and moving forward with it. Tenacity, connectedness and support, integrity, this idea of self-discipline and self-control, and optimism and positive thinking. And so when you look at this list, you might want to think, which of these am I really good at? And which of these do I struggle with? And how can I kind of flex that muscle and practice the ones that I want to get better at? So how do we nurture resilience? There's about 7 areas that can help increase resilience, purpose and meaning being one of them. So this idea of finding purpose and meaning. And I think like Megan was talking about earlier, sometimes when we get the diagnosis of a chordoma, we have to redefine what our purpose and meaning is because our roles might change. Maybe we can't work like we used to. And so finding a purpose can be a really key part of feeling resilient. Focusing on your strengths, and sometimes we have to rethink of what those are because maybe the strengths that were available to us before aren't there anymore. And so really being creative and flexible and redefining those. This idea of gratitude or having a gratitude practice can be so key. And there's been research that shows that having a gratitude practice really rewires your brain, but really taking time each day to think about very specific things that you are grateful for really forces you to go through your day looking for those things. And again, can help tilt that half empty, half full glass view that folks have of the world. Yourself, paying attention to yourself and nurturing the things that make you feel like a person and a human. Goal setting can be important. And sometimes when we think of goal setting, we think of really lofty goals. And goal setting doesn't need to be a big thing. It can be really little goals that, again, can lead to you feeling like you've accomplished something in the day or that you have purpose and meaning in life. Connecting with others, and then this idea of humor can be so important when we think about resilience. So, when we think about non-productive thinking, this is thinking that really isn't helpful. One important strategy for building resilience is through checking your thoughts and paying attention to your thoughts. Sometimes our thoughts happen without us even knowing that they're happening. And so really slowing down and thinking about those thoughts can be important. When we're in a less resilient space, and that can be because we're tired, it can be because we've gotten a lot of bad news lately, it is easier to misinterpret events and jump to conclusions. And so sometimes we may have ruminating thoughts, like a tape going around in our head that says, scanxiety is a good example of that. Just imagining the worst case scenario, or maybe thinking your caregiver isn't caring for you in the way that you want, or caregivers thinking that a patient isn't appreciative of what they're doing. And these are all oftentimes considered non-productive thinking because we're not necessarily accomplishing things with it. There's a rumination, and we may be telling ourselves a story that isn't true. And it's a lot easier to get into these feedback loops when we are feeling less resilient or we're tired. And sometimes it makes us think that we're doing problem solving, but what we really are doing is making ourselves more tired with our thoughts. And so language can be really important in this. We want to try to stay away from black and white thinking, this all or nothing thinking that something could be all good or all bad. Also, overgeneralizations don't tend to be helpful. So sometimes we make patterns. Our brains love to make patterns. And so we'll make patterns that aren't there. And we just want to be mindful of paying attention to those thoughts and really evaluating, is this something that's true, or is it not true, or is it true occasionally, but not all the time? Staying away from mind reading, thinking that we know what other people are thinking, or attributing thoughts to their behaviors that maybe they're not having. Always going to the worst case scenario. Again, it's important to think of all scenarios, but you want to pay attention to how much you're spending in the worst case scenario, and are you creating time for good scenarios in your head. Personalizing, and so comparing yourself to other people, and then being inflexible. So like, I should be better. I should be able to exercise every day. I should not be upset about this information that I'm getting. And oftentimes that really points us in a corner, and really just allowing a space to be can be helpful and important. I like this quote, this idea that pain is inevitable, but suffering is optional. And I think that there can be a lot of truth to this, that our mind and how we harness the strength of our mind can be really important in how we adapt to really difficult situations. So anchors can be really helpful to help us kind of get out of these spirals, or out of these tapes that are playing in our head. And a lot of different things can be an anchor for people. It can be affirmations, which we'll talk about, a visual cue. So right now I'm really using the leaves as they're turning outside as a visual cue to kind of anchor myself in the present. Some people will wear a necklace that they can touch, or they'll twist a ring around their finger, or maybe there's a ritual that you like. But having an anchor to bring yourself back into the present moment when your mind is running can be really important. So affirmations can be new for some people, but some ideas of affirmations are on this screen. It's really important that you write your own affirmations because you want it to be something that you connect with. And oftentimes I may suggest that people put these affirmations up around their house so that they can see it in the mirror when they're brushing their teeth, or when they get into their car on the dashboard, just to really ground you and bring you back into the present moment. and really can be almost a rewiring of the brain to use these affirmations to anchor you. Also using opportunities for self-discovery. I think when we're kids, we're doing new stuff all the time. We're always learning something new. And sometimes as adults, it gets really easy to kind of get into the rut of doing the same thing. And our brain needs excitement. And for some folks, you're probably thinking, cancer diagnosis, this chordoma is exciting enough, but really this idea of doing something fun, of getting out of your comfort zone can be a really good way to connect with your caregiver and connect with yourself. And so just remembering these ideas of self-discovery can be really important to adding to our resilience. And being mindful of your expectations. Expectations are really a very important part of being resilient. Having realistic expectations is key, because unrealistic expectations can often lead us to feeling a lot of despair. And so holding this idea of imperfectness and lack of control can be a really tough space to be in, but also a really important space to be in. And I always come back to this word of flexibility and creativity, because oftentimes these situations in which you're managing a chordoma, being able to be flexible and creative can be really key in having some sense of normalcy and some sense of control over the situation.
So we've given you a lot of information, and we've talked a lot about kind of some of these symptoms of anxiety, depression, and grief. But where do you turn? And I want to go back to that survey that I spoke about earlier that the Chordoma Foundation conducted. 38% of the respondents did not know where or how to access help for these emotional challenges, or if help was even available to them. So I really want to touch base on some of the options available to you all. So it's important that your treating physician be aware of these symptoms that you may be experiencing. Yes, they're treating your chordoma diagnosis, but a lot goes along with that chordoma diagnosis. And it's important that they know about these other symptoms that you may be having. They also might be able to direct you to institutional resources, or they might be aware of community resources local to you that have experience with working with chordoma patients, or that they might know about that might be a good opportunity to work with. If you are comfortable discussing or talking with your personal support network, so your family, your friends, if you're a part of a spiritual community, coworker, anybody that you would consider to be part of your support network. Let them know what's going on or how you're feeling. And sometimes it can be really beneficial to say the things out loud and to talk with someone about them. There are also several formal sources of support available. So licensed counselors, support groups, peer-to-peer networks, things like that. And then another great resource is national organizations like the Chordoma Foundation. They can often direct you to resources available, or they might offer those resources themselves. So some types of patient and caregiver support could be individual counseling, family or marital counseling, support groups, and peer-to-peer groups. So counseling options, again, discuss with your treating physician. Your institution may have licensed counselors on staff, and if they do, your physician might be able to connect you with them, or they might be able to recommend a licensed counselor in the community. You can also contact your insurance company or access your insurance company's website online to look for different licensed counselors that are in network and covered by your insurance. And lastly, there is a website called psychologytoday.com. This is an online database where you can research licensed counselors based on location, or if you have their name, you can look them up there and you can read a short biography about them and how they practice. You can also filter the search based on insurance coverage or specialty to just kind of give you a little bit of an idea of how that person practices before meeting with them. I will say finding a counselor can sometimes be challenging. It might be hard to find somebody that's a good fit for you, and that's okay. And that happens. So if you try someone and it did not go well, or you didn't feel like they were hearing you, or you didn't feel like it was a good fit, I would encourage you to try again. Another type of support are support groups. So the Chordoma Foundation, as Shannon mentioned earlier, does offer a few of them. Support groups can be really beneficial. They can allow patients or caregivers or co-survivors a safe place to kind of discuss what they're experiencing and share their experiences with others. It can also help really build a source of support and build a community for them. The Chordoma Foundation support groups, the patient and survivor group is the second Tuesday of each month at 6 p.m. Eastern time. And the caregiver or the co-survivor support group is the third Wednesday of each month at 7 p.m. Eastern time. Peer-to-peer support can also be a great way to kind of build connections if a support group isn't necessarily your thing, or you feel a little intimidated by that. There's also a peer-to-peer program through the Chordoma Foundation called Chordoma Connections, and that can be found on their website. So now I want to talk a little bit about a few tools that can help with this coping process. So journaling, one tool that can be very beneficial is journaling. It can help you to process your emotions and bring you awareness to kind of how you're feeling at the time by writing down those emotions that you're experiencing and what might be causing some of those emotions. Going off of what Jennifer mentioned earlier, building that resilience and practicing that gratitude, creating a gratitude journal can also be really helpful, where you can record big and or small things that you're grateful for throughout the day, or maybe a few times a week. And then that creates an opportunity for you to look back on those moments of gratitude, maybe when you're feeling a little bit more down or a little bit anxious, and it can create that sense of resilience. A Chordoma Foundation and the treatment associated with it, as you know, can also sometimes leave you feeling out of control or maybe a little bit helpless. So journaling can help you regain that sense of control. And it can also help with your short-term memory as you're able to kind of go back and kind of read and reflect on the things that you wrote down previously. Journaling can also serve as an outlet for our feelings and our emotions that we may not necessarily know how to communicate to other people, or maybe we're just not ready to share those feelings or emotions with others. It's okay to have some feelings that we aren't quite ready to share, but it's also important that we have some type of outlet for those feelings, and journaling can serve as that outlet. So the biggest question that I always get asked is, that sounds great, but how do I start? Where do I start? My recommendation is to start small. Set aside maybe 5 to 10 minutes every day or every other day, a few times a week, and just write down 3 things that you're either grateful for or 3 things that you're feeling in that moment, along with any other reflections or sentiments that you have. And then build up from there, or continue to do that and just remain consistent with it. Another great tool is mindfulness. So mindfulness can help reduce the symptoms of stress or feelings of anxiety by providing a space of your mind for your mind to kind of focus and relax. Mindfulness can also promote better sleep and can uplift your mood as well. So some mindfulness tools, there are several apps available that can kind of help with this. There are certain guided meditations available through like Calm, Insight Timer, Headspace. There are several others. One thing that's important to remember if you're practicing mindfulness is that mindfulness is not about being perfect. So, it's okay if your mind wanders or if you get distracted throughout. What's important is just acknowledging that distraction, acknowledging that, you kind of got a little bit off track, and then trying to kind of refocus yourself on the mindfulness task at hand. As Jennifer mentioned earlier, those anchors can also really promote those spaces of mindfulness and kind of help with that process as well. So to end our presentation, I want to take you guys through a mindfulness exercise. Mindfulness doesn't have to be anything big. It doesn't have to be like going to a yoga class or sitting down for an hour and just focusing or anything like that. It can be something really small. So I want to take you through this really quick mindfulness exercise. So I'd really like you to pause and take a deep breath. Place your feet flat on the floor if you can. If you can't, I'd like you to take your hand and place it on some type of solid surface. Really feel your feet or your hand in contact with the surface beneath you. Now place your other hand on your stomach and take 2 to 3 breaths, noticing your stomach rising and falling with each in and out breath that you take. When you feel comfortable, close your eyes. Now, as you keep breathing deeply into your stomach, out through your mouth, I'd like you to breathe in for a count of 5, then hold your breath for a count of 5. Breathe out slowly for a count of 5. And keep breathing in this way. In for 5, hold for 5, out for 5. Great. Now, I'd like you to slowly bring your attention back to the room. Notice the sounds around you. When you're ready, begin to open your eyes. So that was just one example of a mindfulness exercise that you can do anywhere at any time, and it doesn't take very long. So now our presentation has finished. So I'd like to open up the floor to you all for any questions that you might have or any thoughts that you'd like to share.
Thank you so much. that was really excellent presentations. Both of you, and we do have a number of questions and comments. There's been a very lively chat going on during the presentation, so I'm very happy to see that. One thing that I noticed during the presentation, you both shared so many strategies and tools, and I think that goes to show that sometimes when we talk about going to support groups or going to counseling, and people hear those words that maybe aren't very familiar with what a therapy process might be like, they think, well, it's all delving, sitting and talking a lot, and me just talking about how I feel. And while that is and can be a very important part of it, there are also these types of strategies and tools that counselors and support groups and can offer, that you all would kind of act as a guide for people in those strategies, and to encourage them, and that's kind of people don't always know that those things are part of therapy. And so I really appreciate you talking through a lot of those things that really give people concrete ways to practice things, and things to hold on to. So one of the comments that came through in the chat, and I think it was to everyone, so if participants are following along with the chat, it's there. Someone mentioned journaling on an app on her phone, and that there's always pen and paper for things like that, but there's also technology now that people can access things in a lot of different ways. Just very, very good things to keep in mind. So let's get to a couple of the questions. So when seeking someone, like a counselor, a licensed counselor, is it necessary to find one that deals with mental health within the context of cancer, if we're talking about within the Chordoma community, or would a general counselor be okay as well? You both are oncology social workers, but many people aren't necessarily focused on oncology that much. So is that an important thing for people to be seeking out?
I mean, I think when we think about things like grief and loss and anxiety and depression, those are all part of the human experience. And so, no, it's not necessary. And sometimes it can be helpful because there are some unique things about having a chordoma or a cancer diagnosis that are unique to that situation. And so I always say, if there's someone with an oncology expertise available to you, that's great, and use that. But for some people, that's not an option. I wouldn't let it get in the way of getting therapy or connecting with a counselor. I think the most important thing is how you connect with them as a human being, because this really is a human experience. And so having that connection is probably more important than them having a background in oncology. But if it's available to you, that's good too.
Absolutely. To add to that, the Psychology Today website does have a filter for counselors that work with cancer patients. So you could always go that route. But as Jennifer mentioned, the more important piece of it is the relationship and the rapport that you have with them. And if that's strong, then again, that anxiety, depression, and grief, those are human experiences. The oncology piece could be helpful, but it's not a make or break part of it.
Good. So we have a very interesting and broad kind of question that I think is something that my guess is you might hear from your clients or your patients that you're working with. And so I think that it would be an interesting thing to talk a little bit about here. The question is, how can you find a new purpose again? And what is a good way to do that?
That's a great question.
Really good question. I would say this idea, first of all, what brought you purpose before? You know, I always recommend that people think back as to what brought them purpose before in their life, and what if that rings true, and what if that doesn't ring true, and what brings you joy and meaning. So for some people, I'll give an example. Maybe work brought someone great meaning in life, but they can no longer go to work. Well, what was it about that work? Was it the connecting with people? Was it the doing something positive in the world? Like, is there a global theme? And then how do you incorporate whatever that global theme is into your limitations? And so maybe you can't go to work anymore, but you can have phone conversations with people. And so you find a way to volunteer on a phone conversation type bank. But the first really important piece is really figuring out like what brings joy to your life, or what would feel meaningful. And then how do you be really creative and flexible and think about how that can fit within your current situation limitations? Because sometimes we get really caught up in these big things. Like, it has to be big to bring meaning to our life. But simply sitting with a grandchild and hearing about their day can be something that can bring a lot of meaning to life. Or writing down, you know, things that have happened in your past life and passing it on to your family. There's so many ways we can bring meaning, but it's also really individual. And this is sometimes why a therapist or a counselor can be really important, because teasing these things apart and figuring out how to be flexible and creative to bring that meaning back is hard to do alone. And so having someone help walk you through that can be really helpful and meaningful.
Yeah. I think words like meaning and purpose can sound like really big, right? Like, I have to find my new purpose, and like that can sound intimidating, but it's about the small things. So like Jennifer said, finding those things that you enjoy, and making that your meaning, your purpose.
I think there's also sometimes, and this is kind of touches on another question that was submitted, that Chordoma patients deal with oftentimes physical limitations after treatment that are lasting. And so if there were physical things that were very meaningful in life before, or that are even tools to help your mental health, like physical exercise and activity, that when that's limited, then that affects, you know, that can affect mental health as well. And also it's being able to, if you can, find alternate ways of getting that physical activity or doing the things that you love, and that those things can really be impacted for people after treatment as well. Something that we interestingly had two people touch on was that they not only dealt with a chordoma diagnosis, which is devastating in itself, but then each of them noted that they lost loved ones about the same time. And so they're dealing with grief and loss of a loved one, and then also a chordoma diagnosis, which is its own type of grief and loss. And I think, you know, that's, I would guess, something that you both might have run into in practice before, is that you're not only working with your oncology patients who are dealing with cancer, but then that doesn't mean that other things in life don't happen. And that can be devastating, totally apart and separate from the cancer diagnosis. So in those kind of situations, what kind of encouragement and advice do you give to those people? Someone called it double grief.
Yeah.
Double grief.
Because life doesn't stop after you've been diagnosed, right? And with life comes those losses and those challenges, and coping with both at the same time can be difficult. I think it's important to remember that you're allowed to grieve both in different ways. I've spoken to some patients that are like, yeah, I have this diagnosis, but at least I'm still alive, so I can't feel too bad. And I mean, you're allowed to feel sad about both things at the same time, and that's okay. And allowing yourself that grace and allowing yourself kind of that space to grieve both of them, because they're both devastating events or difficult events to get through. So it's allowed to have both of those experiences at the same time. So really kind of letting yourself process them, because I mean, if you don't process them, eventually they're going to come up, right? If we try to shove them down, eventually those feelings and emotions are going to come up, whether we want them to or not. So if we can kind of take control of that situation and kind of process those in some way that's beneficial to us, whether that's through counseling, somebody to kind of help work through both of those traumatic events or both of those difficult events, or whether that's through a journal or through talking with our loved ones. But it's okay to feel sad about both of those separately and together at the same time.
Yeah, I think really leaning into your community, if you have one, and utilizing a support system to talk about these things can be key. To put grief into words can sometimes be really powerful, especially, to do that with other people that it's impacting can be important. And the other thing I just like to remind people is this idea of being really compassionate with yourself and being kind to yourself. I think it's really easy to get into situations, again, where we're using that should, like I shouldn't do this or I shouldn't do that, and really just speaking to yourself in the most kind way and giving yourself the space for grief can be hard. Feeling grief is hard, but also really important. And so this idea of being nice to ourselves is something that I always think we need to remind ourselves of.
Very good points. I think overall, if we're closing in on our hour here, and I guess I want to kind of maybe a closing thought. There was a question about our support groups and the timing of that, the time zones, and of course, the question was submitted by someone in Europe, and so of course we know that the times of our support groups don't make it possible. Certainly not easy to join if you're outside our time zone. So I guess I just wanted to note that from the foundation's point of view, we would like to expand the groups that we offer. We've just been offering these for the past few months and would like to think about how to have those in other parts of the world as well. So hopefully that will be coming. But I think that in general, there aren't very many in-person support groups happening right now, but as we start to get back to those, making the point that it doesn't have to be a Chordoma specific support group necessarily, those just don't exist. Even in very populated areas like New York City, things like that, a Chordoma group doesn't exist, but there are plenty of groups at cancer centers and other places that are focused on oncology for cancer patients and caregivers that people can join and still find value in. I've heard lots of Chordoma patients talk about finding those groups. So just for everyone here, I encourage you to look for those if you're interested in it. And then also, I think just the idea, Megan, you shared the slide of how many people aren't seeking this kind of care. Mm-hmm. And that is very common. The mental health challenges are more prevalent in the cancer patient and caregiver community than in the general population, as you all mentioned, but the seeking care is just not there. And I guess just leaving with words of encouragement for people to seek out this care. And I'm sure at times it could feel like, well, that's just one more person I have to find and one more appointment I have to go to and things like that. But that, you know, this can be so helpful and supportive of all the other things that are going on with chordoma treatment, with side effects and everything. So if you have words of encouragement of, you know, just people really taking the time to care for themselves and seek this out, I think that would be a great way to end our time together.
There's the old airline mask, like put your mask on before you help the person next to you. And anxiety, depression, grief, these all take a tremendous amount of energy. And so I think by focusing on them, sometimes it opens yourself up to having energy to spend in other places that would be really meaningful to you. So reaching out, whether it's to an oncology social worker, your physician, the Chordoma Foundation, can be a really great first step in just taking that next step. It can be a small one, but it could make a big difference in what you're able to do after that step.
Absolutely. And, you know, finding a counselor can seem like a burden at times. It can, right? It takes research, like you have to do a few things. There are a few steps within that. But it's worth it, right? It can pay off in the long run, and it can help you kind of process a lot of these complex feelings that you're having, which can lead to more energy later on, because maybe you're having problems sleeping, and a counselor might be able to help you kind of tease out kind of what's going on and help you come to a place where you can get more sleep, which kind of improves your overall mood and overall quality of life. So it can seem daunting at first, but you also don't need to find the perfect counselor right now. You can start one step at a time, you know, make a small goal, like Jennifer had mentioned, to call your insurance company, and that's all you need to do in one day. And then maybe the next day you can do something else. You don't have to do everything all at one time. You can take it at your own pace.
Very good advice. Thank you. So thank you both. That's all the time that we have. If people submitted questions that we didn't quite get to, or anything comes up after, please email us at support@chordoma.org. But Megan and Jennifer, thank you both so much. This has really been a wonderful presentation today and discussion. So really appreciate you being here with us. And thank you all participants for being here as well, and the discussion that you all have had with each other, I think, is really wonderful. Thank you for that. I hope that you, those who can, will consider joining an upcoming session of one of our support groups. You can register for a group through our website. There is a link to the groups right on our homepage. So you can find out more information easily that way. And I would also, before we go, like to invite all of you to register for one of our upcoming Impact Update webinars. Our Executive Director, Josh Semmer, is going to be discussing achievements made possible by our recently completed All In campaign, highlighting the progress we've made and the many exciting opportunities on the horizon. So you can go to the URL on the screen that you see here and register for one of the 3 times that Josh will be giving the updates. So with that, thank you again for joining us. Take care and be well.